Oral hygiene care for people with dementia may present with numerous challenges, some of which were alluded to during the presentation in Section 1. Now we are going to describe these challenges and discuss how we can overcome them. This slide shows a list of common challenges in providing oral hygiene care for people with dementia. Caregivers have consistently reported that many adults with dementia may present as being very weak. They may get tired easily, they may refuse oral care or to open their mouths, and they may even bite and hit out at their caregivers. People with dementia often cannot rinse and swallow, cannot remember or understand a task given to them, and cannot remember or follow directions. They can be aggressive, both physically and verbally. Furthermore, people with dementia may have decreased access to fluoride sources as they drink less water. In addition, many times people stop using fluoride toothpastes out of fear that fluoride may be linked to dementia. In fact, there is no evidence of a causal relationship between fluoride use for caries prevention and dementia. So, how do we overcome these challenges? We can use concepts that are broadly applied in gerontological nursing, such as task breakdown, chaining, and bridging, and adapt these concepts to oral health care. Task breakdown is actually breaking down a task or activity into the smallest possible steps. So, instead of telling a person with dementia to brush their teeth, we would first ask them to find a toothbrush, then to open the toothpaste, apply the toothpaste to the toothbrush, brush their upper back teeth, and so on until the activity is finished. Chaining requires understanding which parts of the activity a person can still do. In the two pictures on the bottom, you can see the caregiver initiating the activity, toothbrushing, and then the person finishing it. This helps increase the person's autonomy. Bridging is related to the ability that people with dementia often still retain for oral hygiene activities. So, if you give the person a toothbrush, it may help remind them what toothbrushing is, thus making the activity easier for caregivers. This woman provides an example of bridging. She was in a severe stage of dementia, thought to be totally unaware of her surroundings, nonverbal, and non-communicative. Performing oral exams was always hard, so the dentist tried the bridging technique by handing her a toothbrush. After quite a long time, she actually started brushing her teeth. For chaining, one important question is when we should start performing checks after the person completes their oral hygiene. Although it is important to preserve the person's ability and independence, it is also important to start those checks in the early stages of dementia, before the person starts to present with more aggressive behavior. Another standard technique that works very well for persons with dementia is distraction. Allow the person to play with things like activity boards, aprons, or boxes, or familiar or favorite tactile objects. Singing favorite music during oral hygiene care may also be helpful in getting more cooperation from the person.